Hello, everyone, and welcome to McGill Cares webcast series supporting family and informal caregivers. I'm Claire Webster, a former caregiver, certified dementia care consultant, and founder of the McGill University Dementia Education Program. I work with a dynamic team of leading healthcare professionals to oversee the program, who include Dr. José Moret from the Division of Geriatric Medicine, Dr. Serge Gauthier, McGill University Research Center for Studies in Aging, and Dr. Gerald Freed, McGill Steinberg Center for Simulation and Interactive Learning. Today's webcast is made possible thanks to the generosity of the Lindsay Memorial Foundation. We have a very interesting topic today, which is the launch of a very invaluable resource called The Care of the Older Person. The Care of the Older Person brings together some of today's most experienced professionals to provide concrete answers to care providers of all kinds, from doctors, nurses, therapists, pharmacists who build, run, and staff healthcare facilities, and housing for seniors to the spouses, friends, and children who care for them informally. Most importantly, this book also refers for seniors who want to feel empowered at this stage of their life. My four guests are editors and authors of the fourth edition of this book. Dr. Ron Kaplan is Clinical Associate Professor Emeritus, OBGYN at Weill Medical College of Cornell University and a medical author. Dr. Abraham Fuchs is a professor in medicine and a former dean of the Faculty of Medicine and Health Sciences at McGill University. Dr. Serge Gauthier is the director of the Alzheimer's Disease Research Unit at the McGill Center for Studies in Aging and a professor in the departments of neurology and neurosurgery, psychiatry, and medicine at McGill University. And Dr. José Moret is a professor in the McGill Faculty of Medicine and Health Sciences, director of the Division of Geriatric Medicine, lead of the Dementia Education Program at McGill University, and co-director of Quebec Network for Research on Aging. And this is a particularly exciting moment for me, as I was invited to contribute as an author for the chapter entitled Navigating the Journey of Dementia as a Caregiver. Well, I'd like to welcome you all to McGill Cares, and I'm very much looking forward to discussing the launch of this very important resource. So let's start with you, Dr. Kaplan. Why don't you describe this book, how it first came to be, and talk about the subjects that we can find inside the chapters?
Of course. I'm an old McGillian, a very old McGillian, and I've been kept in touch with Abraham Fuchs, who of course was the dean, brilliant educator for years. And at some point, approximately 5 years ago, Abe and I got into a discussion about whether a book of this type was needed. There are approximately 50 million people over the age of 65 in the United States alone, and probably another 6 million or so in Canada. This group of people, there is no way they can be totally cared for by geriatricians like Dr. Moret, of course, who runs the geriatrics program at McGill, famously. And it became clear to us that it would be important to get a book out into the field for caregivers of all types who run into older people like me. And that is probably every caregiver there is, because of the numbers, that we get something out there to guide them and to let them know when they needed more expert help in the care of this huge population, this cherished population. So Abe, of course, being Abe, quickly got together 6 senior faculty at McGill and myself, and we convened in Montreal and hashed out what this book would look like. Abe christened it The Care of the Older Person. Later, I found out, after much care, choosing every word, being an educator. And we came up with this book, and in the first edition, the majority of the editors, this senior group of 7 people, wrote chapters and brought in other people, mainly McGill people, to help them and to write other chapters. We put out a first edition. Well, now we're up to a 4th edition. In 5 years, I think it weighs 2 pounds, and it's got a lot of very good information in it.
So maybe you could just take us through, briefly on some of the topics that we can find inside the book.
Sure. Well, Jose Moret himself, somehow, with all he does, managed to write 3 chapters. And he wrote the introduction, which is basically an overview of the field and where we're going in the future. And then very recently, for this newest edition, the 4th edition, Abe Fuchs took a side time from his regular duties of God knows how many different things, and wrote a chapter about actually caring for the older person, which is what the book is about. And he starts it with a very cogent phrase, which I'll leave to you to read the book so you'll know yourself. Then we got into a chapter on frailty because it's such an important topic for older people, of course. And we started out with just a definition of what frailty was, because there's even some discussion about that. And we counterposed that particular chapter with a chapter on physical activity to deal with frailty and possibly to make sure that you get frailty somewhat older rather than somewhat younger. And then, of course, we got into Serge Gautier's chapters, which were 2 chapters, first about getting forgetful, and then on Alzheimer's disease itself, which is such a huge topic today among older people and their problems. And of course, Serge is one of the world's leading experts in this field, as I'm sure you all know. And then, of course, Claire, we came to your chapter, which is really important, and it's really, you almost made me cry when I when I looked at what you yourself had put out there previously about this subject and about the trials and tribulations of caring for someone you love. It was very heartwarming. Well, then we got into delirium, which of course is acute brain failure. And then we got into gait and balance disorders. Just 2 days ago, a friend of mine took a fall and ended up in the ER needing some stitches. Thankfully, it was nothing much, but we all tend to lose our balance here and there. Then we get into Jose's second chapter, which is about malnourishment and how a caregiver could tell if somebody's malnourished. And of course, it's a very comprehensive chapter. We then got into a chapter about immunizations of the older patient. And it's so important because their immune systems aren't really what they should be. And unless they've got their shots up to date, bad things could happen. And this, of course, was brought out to all of us very, very forcefully right now and in the past year because of the COVID epidemic. And thank goodness we've come up with some very innovative vaccines now to combat COVID, and hopefully we'll get the population immunized before too much death and bad health occurs more than we've already had. We then got into patients in the emergency room. Older patients in the emergency room very often don't show up the way younger patients do, with acute, very visible symptoms. So you have to be prepared to look for them a lot better and to treat this older population in a somewhat different way. So that was very well handled. And then, of course, we got into critical care of the older person, which sort of follows off from that and also ties into the pandemic we're faced with now. We were lucky enough to get Michael Pinsky to write that. And you have to understand, McGill has an incredible bench strength. Michael Pinsky is a revered professor at Pittsburgh. He's been honored all over the world, and he's an old McGillian, and he's like an old fire horse. When the call came, he dropped everything and got somebody with him who's also very good, and wrote this chapter. And then, of course, we got into a chapter on COVID, which is a new chapter also for this fourth edition, and is obviously so important. I don't have to tell anybody who's listening to this how important that is. We then started to talk about stroke prevention, and that's a huge topic in the elderly. It's one of the leading causes of death. And once it happens, it happens. So prevention was the way we decided to go at this first. Our next topic was cardiac care, heart disease in older people. And of course, this is a leading cause of death. We were lucky enough to get a world-renowned professor to handle this. And he is actually a heart transplant surgeon, one of the pioneers, and he was nice enough to come on board. It's P. David Marowitz, and he did a great job for us. And then, of course, we get back to Jose again with a very comprehensive chapter on diabetes in elderly persons. And he makes the very important point that you just can't treat these people the same way as you do younger people with this disease. And I don't want to get into his territory. I'm sure he'll expound on this a bit. We then went into cancer in older patients, and we went at it from two aspects. First of all, there is a new subspecialty just about for geriatric cancer, and we talked about that a bit. And then we went to cancer screening in older people. And that changes too. Obviously, when you're young, you want to be screened for various diseases because you want to live a long life and you don't want to get these diseases, or you want to get them very early so they can be counteracted. When you're older, it becomes a question about, okay, if I'm 95, and if they screen me now, it means I might get a certain condition, say bowel cancer, 5 years from now. Should I really go get this screening? Even though it's not that bad of a thing, but why go there?
Dr. Kaplan, it's absolutely amazing. There's so many topics and so much more than what you've already described in this book. And I highly encourage people to purchase a copy of it because, I mean, it's extremely comprehensive. So, if we can just look at the next slide, because the next slide shows some of the final topics, everything, even including, financial guidance for seniors. And I think most importantly, this book contains a medical glossary, because I know that, there may be some clinical terms that are difficult for lay people like myself to understand. So there is a medical glossary in this book, so that if there are certain terms people don't understand, they can go and refer and understand what they're reading about. All right, so now I have the opportunity to interview the four of you, and so that you can, briefly describe the chapters that were contributed to the book. So let's begin with you, Dr. Fuchs. Talk to us about the chapter Caring for the Older Person.
Claire, thank you. I'm delighted to join you and my colleagues, and I want to take the opportunity as the first responder to pay tribute to Dr. Kaplan, because it's his energy and he was a spark plug in getting this going, and continues to be the editor-in-chief, makes it all easy for us. So I think we all owe a real special vote of thanks to Ron and for all his work for bringing us to where we are today. In brief, what I try to do in my chapter is set the stage, set the scene, and I called it Caring for the Older Person. And it harks back to a wonderful talk by a very eminent physician, Dr. Francis Peabody, in 1927 to medical students at Harvard. And the phrase that's repeated many times, we all quote, is Peabody's phrase that the secret of the care of the patient is in caring for the patient. So what do we mean by that? And I used that in my own title of the chapter, and it reflected in the book, Caring for the Older Person. Caring can mean two things: to take care of, which is the usual physician's duty and mandate, and to care about, which is what we talk about when we talk about family members. Medicine comprises both. The physician, in order to look after the patient, in other words, to take care of, has to care about the patient. We care for each other. And medicine is about caring, the doctor caring for the person. And I'll get to that word in a minute. I believe medicine is relational. It's dyadic. It's something that goes on between two people, whether in a hospital or a clinic or in a home setting. It is the job and the duty of the physician. It isn't simply and only a moral obligation, which is a hefty obligation, but it's the job that needs to be done. It's a responsibility, legal and moral. So why older person and not old person? Because old is a classification. It can be black, white, yellow, or old and young and in between. These are categories. Well, people are not categorized. People live and they change and develop. We may be younger, we may be older. And of course, we change. We get hearing aids, we're suddenly younger in our ears. We take them out at night, we're older in our ears. That's just a trivial example of how being looked after can make one feel younger. Not only that, there's a wonderful literature by psychologists that show that if you feel young and optimistic when you're 50, compared to pessimistic, you grow older, not only more healthily, but you live longer. So the attitude in our heads and our caregivers makes a huge difference. So I don't like old or young, I like older. I don't like classification. I like who are we? We're living, we're identified in different ways to ourselves and to people we care about. And aging is a phase of life, just like younging. I mean, we don't use the word younging, we use it aging, but they're really, in a sense, similar. Finally, I like the word person, not patient, because the elderly are persons first, as we all are, but we forget that sometimes. I also don't like the word because when we think about patient care, in our society at least, we think about acute care medicine, emergencies, fractures, heart attacks, whatever, and we look after them quickly in the ER, and then the patients are gone and we forget. I call it stroboscopic medicine in the chapter. Care of the person is a larger, expansive idea. Who is this person? What's her background? What's the family setting? Do they live alone? Do they live with others? Are they happy? Are they sad? Do they go square dancing on weekends? What do they do? Who are they? I call it in the chapter an impressionistic painting of a person, not a little detail. Show me your hips or show me your blood sugar. So I like this broad idea of caring for. And finally, persons have value. They have their own values, but they have intrinsic value. We need to care for them and care about them. And sadly, in our Western society, ageism is a stigma. We talk all this past year about all kinds of isms, racism and sexism. They're all true. We forget about ageism. So unfortunately, age has a stigma. I hate the phrase, the great tsunami and the great plague, and oh my goodness. That's stigmatizing. We're all people. And finally, care for the older person is preventive and supportive. It isn't intervention when you're sick. It is, how are you doing during this visit? How can I help you come back feeling better for the next visit? Not live longer, no, live better. And so those are the kinds of ideas that creep into that motivate the chapter and tries to set a setting for the book. And it really ends on a very simple thing that we all need as humans. We want to be respected. We want to be cared for. We want to be cared about. And that's where the title and the book comes from.
Thank you very, very much. So Dr. Gauthier, can you give us an update on the chapters that those two chapters that you contributed to, which involve a disease that is very, very, very prominent today?
Thank you, Claire, and congratulations to our editor-in-chief, Dr. Kaplan, for putting this together. My two chapters are on the same topic in a way. One is more for the layperson. Doctor, my wife has some problems with her memory, so it's more like an account of what it is like to go see a doctor about your memory. The other chapter is more for the health professionals who want to know the latest about Alzheimer's disease, but the public can read both if they like. And in a sense, it was a premonition of the work we're doing together, Claire, Dr. José Moret, Dr. Rosanetto, and I, for Alzheimer's Disease International, because later this year in September, we have to deliver one review of diagnosis of dementia. And next year, it will be about management post-diagnosis. So all this to say, it was a great opportunity to write about this important condition, and it will be expanded upon by Alzheimer's Disease International.
Thank you. Dr. Moret, let's discuss your chapters.
Well, first I have to thank Dr. Kaplan that approached me to contribute to participate in this book, which is very dear to me. And frankly, working with people like Dr. Kaplan, Fuchs, Gauthier, and many others, it's really stimulating. I mean, these are experienced physicians, academicians, and they are so vibrant, you know, very encouraging. So then when it came to decide on who's going to be doing the introduction, I mean, I said, I can do it. And then Dr. Kaplan said, you have to make this positive, you know, and through what Dr. Fuchs just said, you know, each of us, we are unique. And this combination of our genome background and the experience of life really contributes to make each of us someone that is irreplaceable, you know, as long as we are in this world, and we still at any age capable of contributing to society, families as well as community at large. And this is exactly what my colleagues here are doing. And this has nothing to do with age. It's just this desire to leave, this desire to contribute. So I was very encouraged with them pushing me to do this introduction. And then later there is 2 other chapters that are more my topics of interest, part of my clinical work as well as research. Nutrition for me is essential to promote healthy aging from the biological aspect, and which is often not paid due attention. And there's reasons for that. I mean, it's so natural to feel hungry and eat. So no one in the medical world is thinking about feeding. But when you get sick, when because of medications and special circumstances that older persons are more facing these situations, then you lose appetite. And we really have to think about assisting them not to miss meals, to favor good dietary intake to promote healthy aging, as a way of combating the frailty, which is a more negative way of aging. And diabetes, it's highly prevalent in older persons. In fact, 50% of diabetes is in people above 65. And there is a lot of, guidelines how to treat, what to give, etc. But when you get to this very advanced age in which there is a lot of frailty, treating diabetes can be counterproductive because what the drugs one uses, you expose the older persons to have severe consequences such as hypoglycemia. So we have to adjust our targets, and this is insisting more in quality of life than treating numbers to bring it to normal, because bringing them to too close to normal, you increase the risk of having these hypoglycemia episodes with terrible consequences. So it was a real pleasure to deal with these topics and being stimulated by a bunch of, I would say, people that are really contributors to society. Yeah.
Well, thank you for that. And I have to say, from a personal standpoint, I'm extremely grateful to Dr. Kaplan and Jose for you recommending that I contribute a chapter on, navigating the journey as a caregiver. And although my focus was on dementia, I think that my chapter could apply to, various illnesses. I mean, for the past almost 16 years, I've been advocating about the importance of becoming as educated as possible as a care partner, my chapter really talks about how the moment that my mother was diagnosed with Alzheimer's disease, I was provided with absolutely positively no information at all from the healthcare, from the clinician about what the disease is, how it was progressing. So my chapter really talks about my prescription of care, as I like to call it, with regards to when you do receive such a diagnosis, what you need to do, and really, really the importance of, I'm grateful to work with McGill because they've allowed me to now develop this McGill Dementia Education Program. But also one of my greatest passions is speaking to the medical students who will become the doctors of the future about the importance of really involving not only the person patient, but making sure that the family or informal care partners are properly educated and supported in order to be able to take the best care possible of the person that the family member or the person that they're caring for, because education is really, really key. So, considering our time, we only have time for a few questions. So I'm going to try to pick up the most pertinent ones because once again, as people pick up a copy of the book, you are going to learn so much about so many topics. So the first question that I really like to ask is, how long do the majority of people live today? Like, what is the average lifespan? Who'd like to answer that question?
Well, if nobody else is talking, well, Jose, you know more than me. You talk.
Well, there is average, average life expectancy. But what is important to consider is when you reach age 65, you have in average another 20 to 25 years. Again, average. And 25 years, it's an opportunity to continue developing oneself. So when I teach medical students and make them realize that at age 65, a person still has in average that many years to live that they already have lived themselves, you know, because at the beginning of their medical curriculum, they are about that age, 20 to 25. So, and there is more and more evidence that we reach advanced age in a better health state. We're still capable of contributing to our families, to our society. Thanks God, there is a bit more time available when you're retired, and if you have the motivation, you really can make an impact, you know. Yeah.
Dr. Kaplan, are women living longer than men?
Women do live longer than men, and I have to give kudos to the OBGYN community because what we've done for the process of childbirth, which was traditionally called the perilous journey, especially in developed countries, it should be all over the world by now, but it's not. That women go through childbirth with maybe a little bit of trepidation, but realize that it's fine. They're going to have a child, and that child's going to be normal, and they're going to be fine. And mostly that's the case in the vast, vast, vast majority of cases. So women now, because of that, do live longer than men. Now we get into all kinds of other questions about why do women live longer than men. And I think that has a lot to do with environment and the society. Women were in some ways sheltered occupation-wise. That's all gone away. Women were sheltered from the more hazardous duties in the military. That's all gone away. And women are there on the front lines and doing everything, thankfully. Thankfully for men who can sit back maybe a little bit more. Nobody's looked at that aspect of it yet, I don't think. But in any case, then we get into the questions of whether women really have a biological advantage, a hormonal advantage, and none of these things have been proven out yet. People have talked about everything from muscle mass in men contributing to earlier heart disease and things like that. But I haven't seen any compelling proof of this anywhere. But the facts are that right now in our society, women are living 4 or 5 years longer than men. And if you look at 100-year-old people, 80% of them are women.
Mm-hmm. All right, Dr. Gauthier, the next question is for you. Is there a correlation between living longer and the rise in the number of cases of dementia?
Yes, yes, indeed, Claire, you nailed it. The main risk factor for conditions like Alzheimer is indeed older age. But the good news is people living now over age 65 are healthier than those a generation or two ago. And the baby boomer generation, I'm at the tail end of it now at age 70. They can hope for a delay of at least 5 years in onset of symptoms if they have any genetic risk since birth. So lifestyle changes, education, and other factors have played a role in delaying the onset of symptoms. And of course, research going on about further improvement in prevention will pay a dividend within one generation.
Dr. Moret, the next question is for you. And so because you're really hands-on at the hospital, you're the one that is seeing patients like frequently. So what are the leading causes of okay, let's put COVID aside right now. So the leading causes of death or injury among seniors?
Well, there is data, showing that cardiac disease is still number one. But I think as the aging of the population is occurring, probably cancer will be, if it's not already now, the top number one cause of death. But close to that, there is other causes that are treatable, including pneumonias, including strokes, including falls. Falls is the sixth leading cause of death in older people, and this can be prevented and with exercise. And so there is I would say, a large group of factors that one can intervene to bring persons to an advanced age still enjoying good health, and this is very encouraging. Already data is there, but we still have to make this effort of getting rid of bad habits, adopt good habits, and we will be the ones taking profits from these health habits.
So my last question is for Dr. Fuchs. Please provide us with the secret to longevity. What can people do to live the healthiest life possible?
When someone is asked a question like that, the audience is expecting some dramatic answer. But the answer is not dramatic. It's the same as how you enjoy life at any stage, which is to start with enjoying it. And part of it is attitude. Part of it is self-care. Part of it is a harder one, which is avoiding the foolishness of youth. In other words, dangerous practices when you're young, but we don't, when we're young, really think about what happens later. So it's nutrition, it's society, it's family, it's friends, it's loving and being loved. It is a panoply of, and it comes from both within and the outside. The within part is our own sense of who we are and happy with what we are. It's not worrying about it, as one of my colleagues said, don't worry about accumulating assets, accumulate experiences, right? Make sure that you have lots of experience to think about, because those give you a lot more comfort and warmth than counting your bank balances. And in our Western society, we're much too oriented to money and what the market did today. I think we ought to say is, how's our family doing today is far more important than what the market did, or our friends or our colleagues. I mean, look at how much fun we've talked about, even in the last hour, of working together to write the book. And for us, it not only is a memory, it continues to be a living experience. So we look forward on to more chapters and to feedback from the audience and from people who read the book. So it's attitude. And I learned this past year, if I may, a little bit of social critique. I learned from the COVID epidemic that we refer to two groups in our society as essential workers: teachers and caregivers in nursing homes. And it occurred to me that one of the reasons that our students didn't do as well as they should have done or could have done, and the elderly in nursing homes didn't, is we speak of these as essential workers and heroes, but we pay them a pittance for the work that they do. Our society has to speak more loudly in valuing and supporting what we care about. And as you can hear here, caring about older persons is part of what makes us as a society with some hope and, in fact, optimism for the future.
Thank you. Dr. Kaplan, how can people purchase a copy of the book, in addition to it being available at mcgill.ca/dementia?
The book is available just about everywhere. It's on Amazon. It's on all other booksellers, or most of them. It's an ebook, and it's soft cover. So a lot of options. It's also, at my last count, about 125 libraries, prestigious libraries all over the world. And it's real easy to get a copy, not difficult whatsoever. Or you could go to our website, which is www.careoftheolderperson.com.
Which is a great website, because it has the full list of all the contributors who have made it possible for this book to come together. And we'll have a full list of the contributors as well. Well, gentlemen, thank you so much for joining me today on McGill Cares.
Thank you.
Thank you, Claire. It was a pleasure.
Thank you.
Merci.
So please join me on Wednesday, May 12th for a special 60-minute one-year anniversary edition of McGill Cares. Gosh, it was a year ago that we began. And the title will be A Prescription of Care Following a Diagnosis of Dementia. And I have the honor to be joined by my colleague, Dr. José Morin, with me. I will be sharing my own journey as a caregiver to my late mother who had Alzheimer's disease, the ripple effect that being a caregiver had on my own health, my family, and I'll be sharing some of the most important lessons that I learned, especially those that could hopefully help people avoid having a severe burnout like I did. This webcast is an initiative of the McGill Dementia Education Program, which is funded by private donations. Once again, I would like to thank the Lindsay Memorial Foundation for supporting today's webcast. If you would like to make a contribution to our program, please visit us at mcgill.ca/dementia. And if you have any questions or you would like to get in touch with us, please email us at dementia@mcgill.ca. Thank you for watching.